fun part of my job is to get to hear all of the work that you all are doing on the front lines and get to see the movement growing and learning and really happening on the ground. So that is really the thing that gets me up in the morning. I won't take a ton of time because unfortunately I have to go to another meeting at 2. So I know that we've made some adjustments to the calendar to accommodate, and I'm really grateful for that. And so I'll keep my comments short and just say thank you so much. I'm so excited and can't wait to hear what everyone is up to.
Thanks so much, Dr. Burke Harris. So in a moment here, I'm going to turn things over to our first presenter, Tara Millebrand from AAP. And so just to let you all know in terms of format, so what we're going to do today is hear from each of the grantees. And then as we did last time, Dr. Burke Harris will ask a question or two of the grantee presenters. And then we'll move on to the next presentation. The idea is that we want to make sure that Dr. Burke Harris has the maximum amount of time to interact with all of you directly. And then for the final half an hour of this webinar, we will open things up for kind of broader discussion among all of us and the audience. And we'll have some discussion questions that we'll put out there for all of you, but we'll also be very interested in your individual questions. So with that, I will turn things over to Tara to start us off.
There we go. Hi, I'm Tara Millebrand, Project Director for the local chapter of the American Academy of Pediatrics, serving San Diego and Imperial counties. Next slide, please. Our chapter is dedicated to achieving physical, mental health, and social well-being for all infants, children, and adolescents. And we support our pediatrician members in this endeavor. So while our work does support the practice of pediatrics, we're unique from other member organizations in that we also run programs that serve children and families. So we provide local pediatricians with training, education, and ongoing technical support so they can provide their families with high quality care and link them to critical social services. And we have over 500 pediatrician members who advise and direct our work. Next slide. We're a trusted partner in the community, convening cross-sector groups to address emerging issues for young children and running countywide programs that support the healthy development of children for over 15 years. And all of our programs combined served over 100,000 children last year. So I just want to give you a little bit of background of our work because it explains how we were really able to jump in and gear up quickly. So 2 of our longstanding programs are Reach Out and Read and Healthy Development Services. Reach Out and Read is a national program, and through our Reach Out and Read San Diego program, we provide training to pediatric providers on early literacy anticipatory guidance, ongoing technical support, and new culturally and developmentally appropriate books for the children they serve. We have over 100 pediatric medical offices participating in Reach Out and Read throughout the county, and participation from all the healthcare groups, including federally qualified health centers, Indian Health, the military offices. And so over these last 16 years, providing early literacy guidance has become the standard of care in our region. And our chapter is also the countywide coordinator for Healthy Development Services, a program of First 5 San Diego. And Healthy Development Services is a system of care that screens, assesses, and treats young children with mild to moderate developmental and behavioral concerns who would not otherwise qualify for existing early intervention services. And as a part of this program, we work closely with the pediatric medical offices to ensure that they're educated on the services available to their families and how to make the first and best referral. So over the years, we've provided in-office education on various health topics and convened committee meetings with our pediatricians to address emergent child health issues. And these committees are led by a pediatrician. And then at the end of 2019, we were hearing from our pediatricians about their concerns on how to implement the new ACE screener and what they would do if they found something. And these were some of the same concerns we'd heard from pediatricians when developmental screening started and before we started the Healthy Development System service of care that I mentioned that provides treatment for children with mild to moderate behavioral and developmental concerns. So now pediatricians in our community have really come to depend on these programs, and they say that they can't imagine practicing pediatrics without Reach Out and Read and without healthy development services for their families. So to address this new need with ACEs, our member pediatrician, Dr. Wendy Pavlovich, stepped up to lead a new ACEs committee. And then we were really excited in 2020 to get our 3 new ACEsAware grants and really help this become the standard of care in our community. Next slide. So for all of our programs and projects, we've built on previous proven practices in order to be successful and applied them to our ACEs work. But due to the pandemic, we've had to make quite a few adjustments to make that work. So starting with the supplemental training grant that we've received, this has really given us the opportunity to develop trainings for individual offices to support their efforts in screening and responding to ACEs. And we modeled this training after other trainings we do with our other programs, where we identify a physician champion at the office to champion the project, get everyone on board, and then have a pediatrician present the information to them. And because we had these pre-established relationships with the offices, we were able to easily reach out and offer the ACEs training. But I just want to mention that that process wasn't that easy when we were initially recruiting offices to start Reach Out and Read. And back then, we really had to rely on our member pediatricians to personally reach out to pediatricians and encourage them to participate. So our training model is to invite the front and back office staff to a lunch hour training and incentivize attendance by providing lunch and Reach Out and Read books. That are focused on the topic that we're presenting on. So for ACEs, we're providing social emotional books, such as Mindful Tots and I Like Myself. So when our pediatricians started hearing about our intent to train on ACEs, they began to reach out to us, and we were able to provide the first training in December once we had all our materials approved. And we learned a lot from this first training, and then also in speaking to the offices in preparation for the next training. So not all of the things that we had done in the past, our strategies working with providers would continue to work during the pandemic. And we were constantly learning and shifting. We were finding it was incredibly difficult for providers to attend lunch hour meetings between meeting patients at their car, having to change their PPE between patients. They just had little time left for lunch. So by speaking with pediatricians and reviewing the post-training surveys, we also found that support staff needed to spend more time on the background and science of ACEs and trauma-informed care, while most of the providers had already done the ACEsAware core training and wanted to spend more time on scripts, self-care, resources, and referrals, and those types of things. And we also learned that it's best to have participants on their own device so they could actively participate instead of having several people viewing a screen with the keyboard not accessible to everyone. And then we were also coming up against timing because more patients were returning to the office and they were becoming busier and having less time for lunch hour trainings. So we've had to adjust and tailor for each of our offices and what they're going through. And so for our second training, which we just did last week, we worked with a healthcare group with 3 locations to present the trainings to an all provider meeting in the evening. And we actually had 40 people in attendance at that. And each provider logged in from their own device. And it really helped to have each person on their own device and have more interaction. And then also by focusing just on providers, we could spend more time on the issues that were most relevant to them. So now we're working with the physician champion at that healthcare group to do a separate training for support staff at each of the individual offices and spend more time on the points in the presentation where they want to have more knowledge. Next slide. So then our second grant is a peer-to-peer grant, and that's really given us the opportunity to develop learning communities amongst our pediatric medical and behavioral health providers through bi-monthly ACEs committee meetings and quarterly developmental and behavioral pediatrics meetings. Attendees are in various stages of implementing ACE screening, and these meetings have really been invaluable as offices are navigating the process. Discussions have included best practices, lessons learned, scripts, workflow, discussions around screening results and how pediatricians can partner with mental health providers to best serve the families, including addressing parental ACE history. And we've discussed electronic medical records and coding and smart phrases and all those sorts of things. So we've been able to use these meetings also to inform participants on training opportunities and resources on the ACEsAware initiative, especially connecting pediatricians to resources in their community through our work on the network of care. And then after discussion at one of these meetings about pediatricians' desire to understand and be able to explain different therapy modalities to families, we applied for a small grant to provide an upcoming training to pediatricians. And we're going to work with other AAP chapters to invite some of them as well. So these meetings also allow us to receive direction and expertise on our work and on how to best support pediatricians. And this grant has allowed us to reach out and really grow the group to all the different healthcare groups in the region, as well as the county child health officer who attends. We're able to provide the county child health officer with additional information and resources to share back with county leadership and managed care plans, trying to lay that foundation for a robust ACEs network. The peer-to-peer grant has also allowed us to host bi-monthly office hours, providing technical assistance on implementing and responding to the screening, and have more in-depth topic conversations on self-care anticipatory guidance. But as I've mentioned, we've had to shift our approach in the pandemic. Lunch hours are not well attended. We're planning the next office hours in the evenings. We know this is a really great resource and we really want to get it out to everyone. The conversations we have are just wonderful. And then we're also going to make post-meeting recordings available and try to advertise them a little bit differently as well. Next slide. So lastly, we're really grateful for our communication grant. This has really allowed us to step up our game by developing materials and content that resonates and engages people like we've never done before. So communication is woven through all three of these grants, from how we advertise about events and trainings to how we can more fully engage people. We've even had articles about our ACEs work and pediatricians in the community in several major publications. One thing pediatricians have told us is they felt overwhelmed by the different communications they receive on ACEs. So we review all of the emails, newsletters, social media posts to really find the most relevant information and post in our new monthly ACEs at a Glance newsletter. And we also pull clips from past events to share since we know everyone's so busy and unable to attend all the great meetings and trainings that are out there. So pediatricians have told us they're very grateful for that newsletter, having everything in one place. And then to better support ACEs communication in our region, we meet monthly with the other ACEsAware communication grantees in San Diego. We also meet regularly with the other AAP chapters in California who were awarded ACEsAware grants, sharing best practices and lessons learned. And we've really worked to align our messaging while establishing each of our own target audiences. So our work isn't duplicative. And we've done things like release joint press releases or joint communications, collaborating on our messaging, sharing each other's work, and participating in each other's activities. And then also as part of our communications work, our pediatricians have spoken at different events around our region on ACEs and met with cross-sector leaders to inform them and build the infrastructure. And next slide. And our last work is San Diego State University, the Social Policy Institute received an ACEsAware Network of Care grant, and we partner with them on that. and they convene pediatricians and community-based organizations in 4 different regions in the county to allow them to become more familiar with the local child and family services offered in the community and really build out those relationships. So in the past, we've always provided our pediatricians with information about community resources, but this is really an opportunity for them to get to know the CBOs in their area, to understand their services more fully, and how to really help families to access them. And these convenings have also allowed our pediatricians to work through challenging cases with someone right there to help them direct them to the different services, and work through issues of bidirectional communication. And then, of course, with everything, we then share what we've learned at these convenings back at our committees, at our virtual office hours, on our website, and our newsletter. Whew. So I've covered a lot. There's a lot going on. But I'm really grateful for our pediatricians who are the experts, and they're here to answer questions. So that is Dr. Pradeep Gidwani and Dr. Wendy Pavlovich.
Thanks so much, Tara. What a great presentation, and it was so interesting to see how you all are using the different grant types to stack your work and make sure that it's all in sync. So really great presentation. Thank you. Dr. Burke Harris, I'll turn it over to you.
Wow, this is just so impressive. I am so thrilled to be able to hear about and see a little snapshot of all of your work. And one of the things that I'm really impressed by is that level of collaboration and coordination. What do you think are some of the factors that helped you all be able to connect and collaborate successfully?
So I'll jump in. This is Pradeep Gidwani, and one of the things that's really happened is we have really established long-standing relationships with partners. And one of the key things is whenever we bring folks together, we actually really spend a lot of time preparing for a meeting, so no one's time is wasted. The other piece is we really take people's input, we listen to it, and we feed it back. And I think engaging people in the process really helps. And Tara has been fantastic about maintaining relationships with the offices going on over 15 years with Reach Out and Read. Her work with Reach Out and Read was really pivotal. We've had a consistent executive director, Meredith Kennedy, and they just do such a great job of being consistent in their communication and building relationships. And as an organization, I would call us, as an organization, we're relational 360. In every direction we go, we're always about the relationships and being reliable and neutral and always looking out for the mission, which is to help kids and families, which fits so beautifully into the ACEsAware work and really going upstream. So I think those are some of the pieces that have really had a big impact.
Great, thank you. In the interest of time, thanks everyone for your understanding. Oh, I'm being told we can do one more question. If you have another question you'd like to ask Dr. Burke Harris.
Yeah, so as you all pivoted and kind of figured out what worked and what didn't work and were course correcting, how were you getting feedback from the providers, and what was the response that you got?
So we were soliciting feedback actively in the meetings, and then after meetings through direct email communication. One of the reasons we have been so successful with collaborations is, again, those relationships, and where we were working together with multiple folks that were on the committees, whether it be our ACE committee or developmental PEDS committee, to kind of hear what's working best, and then just immediately changing things. We have pretty warm, open communication. So people in the meeting were like, yep, this is too open. We need some slides to introduce this. We need to then take these clips and share this information in a different way, or produce a handout or a product for all of those folks that couldn't make it. And I think then that iterative response has really helped gain trust, and then have people say, no, you really should go to that meeting. You really should go to that network of care lunch, because you actually will get guidance and help that you need with whatever problem that you're facing. We also include our members in the meetings and the presentations in an interactive way, but also in like a leadership way. We spotlight the different offices who are doing ACE implementation, because they're all at different phases, and actually give them a platform. And that's been truly successful in having people have dialogue in these evening meetings, rather than just feeling like we're a didactic presentation.
And I just want to add that reviewing that post survey is really helpful, because you get a lot of information when you're going back through that. And then for adjusting how we're advertising, we started looking at, where are our members on most? And we're looking at now Twitter. Like, so many pediatricians are on Twitter more than they're on Facebook or anything else. So we're going to really focus on that for some of our advertising now.
Awesome. Really fantastic. I'm so thrilled. Congratulations for your great work.
Thank you.
Yes, thank you. And thanks for the presentation. Next, we're going to go to Magdalene